is going to really help you get an idea of what we do. And so let's jump right in. So how many of you have been told that you need to lose weight in order to get healthy? And maybe this is not your primary concern, is losing weight, but just suppose that that if you've probably heard this before, you've probably heard it some way or another, is that, well, all your health problems will go away if you just lose the weight. Well, I like to turn that around and I say, in order to lose the weight, you need to get healthy first. You need to get healthy on the inside of your body first. And so what does that take? Well, you've got to learn where your hormones are, what your current hormone status is. Those have to be measured, and that's something we take a look at. Hormones are more than just fat burning or fat storing hormones. They're your women's health hormones. They might be your thyroid hormones. They might, for guys, it might be testosterone. But the main idea is, as we get older, our hormone receptors become plugged by toxins and stress and poor nutrition. And then we wonder why our metabolisms slow down. So we've got to find out where you're at and turn on the fat burning hormones, which are your anti-aging hormones as well. And then we have to turn off the fat storing hormones. We have to turn off insulin, estrogen, and cortisol. And to a degree, you're never going to completely shut them off, but they need to be in a proper balance. So what about the hormones? Well, we've got, when your body starts to gain weight, when there is a hormone balance, there's 4 basic body types that we've noticed. And these 4 body types right here, you may or may not recognize yourself in one of these, and but the main idea here is, if we start on the left side and we see that we've got that image with the kind of saddlebags type where the weight is put on around the hips and the thighs. And this is an imbalance in estrogen, too much estrogen in the body. And estrogen dominance is a fat storing hormone, and that's where women with estrogen and receptors, most of the receptors around the hip is where those fat cells will start to accumulate toxins that mimic estrogen. So we have to typically do a detox when we see this, and we know that we need to be checking estrogen levels to get their balance corrected, know where we're going. The next type is this lower belly fat, low-hanging belly fat, the gut that most people start to develop. And this is excess cortisol from adrenal. So this is an adrenal body type. And this might be the stubborn belly fat that you just cannot get rid of. And it's due to having excess cortisol in the system. So we have to find out where your cortisol is, and we do a cortisol panel for that. And the next one is the overall, where you tend to hold body fat all distributedly, all equally throughout your body. Your neck, arms, your legs, your belly. And we've got thyroid receptors in every single tissue of your body, not just the belly or the hips. So the thyroid imbalance will typically result in that type of body type. And then the final one, we've got the insulin resistance and fatty liver disease that's occurring, and this is the upper belly fat. So we'll see the body starts to try to protect the liver and build a layer of fat and even fluid around the liver, and that creates a very kind of hard, feels like a bowling ball under the rib cage. So this is a very typical picture of someone that's heading for liver failure and insulin resistance, which is basically diabetes. So we literally have to get your body healthy in order to lose the weight. You can go on a diet, and a yo-yo diet, and you go up and down. But until you deal with the hormones and fix them at the root level, find out where they are, and then change the lifestyle so that you fix the hormones, then your body will permanently readjust its hypothalamic weight loss, and it will be a permanent result. So how many of you have been told that you go to the doctor and you've been told that all your labs are normal and everything looks fine, and then you start wondering, is this all in my head? Am I not feeling good because it's all psychological? And what they don't tell you is that the lab ranges that your doctor runs may be inaccurate for you. So these lab ranges are based off of healthy individuals in their 20s, and it's based off a very large bell curve that are rather than individual case-by-case basis. And so many people are discouraged when they find out that the labs, everything looks great. Your thyroid looks great, blood work looks great, yet you still have all your symptoms. So the type of testing that we do in our center is what's called functional testing. Functional lab values are tighter in so that we can see a closer range of where we know that if you're outside of that, you're headed toward a disease process. If you're outside of it on this side, you're headed toward this disease process. So that it's a much more sensitive scale, and it helps us to pinpoint and put together a puzzle piece, all these different puzzle pieces that give us a clue as to what organ or what gland is not functioning correctly. And then we have protocols to actually treat that functional problem rather than chasing a symptom around with one medication or another medication on top of that to control the side effects to the tune of, you know, the average American over 65 years of age is on 5 or 6 medications. And it all started with one medication that they started taking. So an example would be your TSH, thyroid test. So a functional range, in conventional medicine, we see a range as broad as 0.3 to 5.7. And I can tell you if you're down that low at 0.3, or if you're at 5.7, you're waiting around until the disease is getting worse. And oftentimes the only intervention then is either medication or they want to radiate the thyroid. So when we do functional testing, our goal is to get you between 1.8 and 3.0 naturally. And this can be done by training the function back into those glands so that they're talking to each other again. By removing stress hormones, for example, cortisol. Cortisol will block the function of and the absorption of your body's thyroid hormones, T3. And oftentimes we see that with thyroid disorders, most of the time, the majority of the time, 90% of the time in fact, it is actually an autoimmune disorder. So when we look at Hashimoto's and Graves' disease, these are called thyroid disease patterns in conventional medicine. But if we get to the root of it and actually look at what's causing it, it's an autoimmune problem. It's an issue with the immune system going haywire. So in order to address it really at the root, if we fix the immune system, then the issue is corrected. We want to consider all factors. So we want to test, not guess. Your health is important to you. And so this is no time to guess. If you have your labs, please bring them in. If they're within the last month or 2 months, definitely bring them in. We'll see if they ran the comprehensive thyroid or your blood work. And oftentimes we find that it will fit part of the picture, but the things that we need to look at is much more comprehensive. It goes at a deeper level. The other thing we want to look at are for you guys is your testosterone levels. So in conventional medicine, they typically say that anything around 250 is, you know, if you're getting old, and 250 is, you're doing pretty good. But there are ways naturally to get your testosterone up to a functional level. So our goal with the guys is to get your testosterone up around 650. Another thing we want to check, and by the way guys, when that is done, you're going to be feeling like a man again. You're going to be feeling virile. Your libido will come back, and you're going to be feeling incredible. You're going to feel strong and younger, literally, and you'll drop weight like really easily, because testosterone is a fat-burning hormone. We also want to check and see what the salivary cortisol profile is. So this means how much cortisol is in your saliva at different times of the day. So if you've got this red line here and that's your test profile, we compare it to a normal profile where it should be following your circadian rhythm. So the first thing in the morning is you want your cortisol to be high. That's what gets you going in the morning. That's what wakes you up. And then you want it to drop as you go through the day. You want it to drop down to virtually zero so that you can get tired and fall asleep. So we can see it if your cortisol is too high or if it's too low, you're not going to feel right. You're going to have insomnia. You're going to have energy crashes through the day that are abnormal. Maybe you're going to wake up feeling completely exhausted, and without that coffee you just can't get started. So we want to put this all together with these tests that are very beneficial in terms of us figuring out what's going on. Basically, we want to put all the missing pieces together with all the types of testing that we're doing. So we put all the missing pieces of the 5 pillars of health. The first one is nutrition, second is hormones, third is detoxification, customized fitness and customized nutrition, and brain health. And when we put these all together, we have a system where if we leave any one of them out, we're not going to get the results. So obviously if you're wanting a comprehensive approach and you're wanting to learn how to do this, then you've got to have a mentor. So we put all these pieces of puzzle together in a way that is treating you as a whole person. It's treating you holistically. It's treating you comprehensively, and it's getting you involved in the process. And then step by step, you learn what's working, you get results, and then it's yours. Some people, some of our patients say, well, I've tried the Jenny Craig or I've tried the Weight Watchers and it didn't really work. And the failure is not necessarily their fault. That's a cookie cutter approach, and cookie cutter approaches only work for a certain percentage of people, but they don't work for everyone. And so that system was due to a failure of the system, not of the individual. And so what we find is when we put all these pieces together, your success rate goes dramatically higher. And that's the reason why we're able to get the results that we are, is because we teach you and we put your health back in your hands. I love this Chinese proverb, tell me and I may remember, show me and I will remember, involve me and I'll understand. So we want to get you involved in your health. This is not a come to the doctor and get fixed type of treatment. It's about actually fixing where the problem is, at the underlying cause. Remember, knowledge with action becomes power. So if you're with all this information, if you don't take action on it and do something about it, then it's just more information, then it's just another idea. But the only way you can actually become empowered is by taking action steps on it. So that's the idea. What to do next? Well, take action. Stop procrastinating. You basically want to, we're all really great, oh, excuse me. We're all really great procrastinators. I will be the first to admit it. But then if I really push through it, something that really needs to get done, that's the only thing you have to get feeling good about it first, and then take action. So the best way to predict the future of your health is to create it yourself, and that is by, first thing, suppose you're saying that, okay, this sounds great, what do we do? What do we do next? Well, we've got to order the correct tests, not guess, and then we've got to, through those tests, we're going to determine what the underlying causes are. And then we're going to start treating the causes, not the symptoms. And we do this using a drug-free approach. Our goal is when it's possible, we're going to get the function in your body back so that you don't have to take the medication. Because if your body's functioning, you will not need a medication unless, of course, it's something like you don't type 1 diabetes and you don't have a pancreas that's functioning, or your thyroid is gone, then obviously you're going to have to stay on those medications. And we want to address your whole body. We want to address the whole person, that it's you, not just focus on your symptoms. And we do this using a systematic approach that's step 1, step 2, step 3, using a mentorship and coaching. And anything that I've done important in my life has always been done through a mentor. I've learned this medicine through a mentor, and it's always been the most meaningful things that I've done in my life that have been done through a mentor, through shortening the current learning curve. And then you're going to get the entire amount of care that you need. Whatever you need, our program has an entire team that focuses on the emotional, the chemical, the mental, and even at the physical level, the musculoskeletal, and even the spiritual, mental, emotional aspects of it. So whatever you're going to need to get that comprehensive approach, you're going to get. Think of it like a concierge program. So what is it that we're looking at here? Well, we're looking at a lifestyle program. When we've got to do it a comprehensive approach, we have to address the lifestyle. There has to be some changes there. Can you see any other way besides making changes in your life if you really want a permanent results that stick? So we're going to sit down with you knee to knee, and we're going to ask you questions that you've never been asked before. And that is basically a complete wellness evaluation that we're offering at our center. And if you've gotten these videos, maybe you've already had this wellness consultation. If this is before you've come in, then and you've looked us up and you found us online, or you saw us on the provider website of your insurance, however it is you came across us, this is our way of just educating you to let you know what it is that we can do to comprehensively address your issues. So we're going to do the consultation and wellness evaluation, and then we're going to come up with a plan of action to really solve your problems. And typically our cost for this type of visit is $397. And just to disclose our costs, it's something that if you found us online, this is not a billable insurance visit. So when we do this wellness evaluation, it's digging in and finding out what your goals are and what's been going on. And so we can't typically bill that to your insurance. So the most of the time it's a out-of-pocket investment, and instead of the $397, which is a specialist's cost, we're reducing that to $110. And that $110, it doesn't really cover our time, but what it does is allows you to come in, and it reduces some of that financial barrier. But we can't just give it away for free, because we have to have a little bit of commitment and skin in the game, knowing that you're serious and that you want to make those changes. And if you have a spouse or an additional family member, they just $77 additional. We have financing. We can help you out with this cost up front. If you happen to have found us through a special where we already got you in your wellness evaluation, we will honor that. But just know that typically this is our cost of our sitting down with you for up to an hour to find out what's going on. This is a very reasonable cost there, and investment in your health. Your health is the most important asset that we have, and so taking it seriously and acting on it is the best thing we can do. So we thank you for watching this video. Thank you so much. We look forward to seeing you on your consultation visit. If you have any questions, please do not hesitate to call. Our number is 206-624-0397, and our website is www.pinnacleintegrative.com, and we look forward to seeing you at our clinic. Thank you so much for watching.